Yeah, hello, Mr. Cleve.
Hello.
Good. Nice to see you after 6 years now.
6 years. It's just gone by so quickly.
Yeah. You lost how much weight? 30 kilos?
30, 35 kilos, 30. Yeah. I have been lower than what I presently am, so maybe 40 kilos at the
40
most.
kilos,
yeah.
Okay. Your weight was 120 earlier, and now you are?
Varies, but between 70 or 80. 70 or 80.
Okay, so you are about 40, 45 kilos, maintaining there.
Yeah.
Okay, let's talk about the nutritional deficiencies after mini gastric bypass. As you are already 6 years down the surgery, you can better, tell our patients that how you feel about it. We have tested your blood, and even in UK, I think you must be getting it tested.
Yes, occasionally, but because I come here every year for a check-up.
So your hemoglobin is 14.4.
Is that good? That's good.
I think that is very good, which very good normal limits, and even after losing 40 kilos of weight and maintaining it for good 6 years, your hemoglobin is 14.4. And about iron, it is 83, which is very well within the normal limits.
Okay.
And then your calcium is 10.3, which is very well, pretty normal. Vitamin B12 is 485, which is very well within the normal limits. So what we see is all your investigations are within normal limits.
Yep.
And your vitamin D3, which was already low, and which I think...
Well, it's very common in the West. 3 out of 4 people in the UK are deficient in vitamin D.
We would rather say that in UK or Norway and these countries...
We get very little sun.
You get very little sun, and we should rather redefine the normal limits of
so I think everyone in the UK will have to take vitamin D supplements.
They have to take vitamin D3. But still, now, after losing weight and having MGB, your vitamin D3 is 19.6, which is slightly
Well, my
low.
calcium tablets, they have vitamin D added to it. Not enough. It's only about 800 milligrams a day, and sometimes I take 5,000 because
but this
I'm well
vitamin
low.
D level is much better than what you had before surgery.
Well, yes. Well, I never measured it. It was only in recent years that vitamin D levels have become important in the West.
UK. Earlier they were not.
Before it was never mentioned. It's only because a dozen books came out on the subject.
What we see normally in the females coming from West, they normally have a vitamin D of 5 or 6. So this
yes, because all the time the emphasis is, wear sunblock, protect your skin. Cancer is rampant throughout the West.
Because see, now you have lost weight, so you are more mobile. You are running throughout the day.
Well, I'm not running, but
so that's good. Okay, nutritional deficiencies. So what do you think? How are you controlling your nutritional levels?
Well, I overemphasized the calcium because I was frightened afterwards, and I did develop kidney stones because I was having my calcium tablets and drinking a lot of milk because I was worried about that. But in fact, I overdid it. And I developed kidney stone, but it was only a minor thing. They came out naturally within 2. But I was in a lot of pain because if you've had kidney stones, you think you're going to die. It was, you'd never had pain like that before. So after that, I adjusted my calcium intake so that it was
How
normal.
many tablets of calcium you're taking every day?
I take 2 tablets a day, which is a recommended amount.
Okay, and about multivitamin tablet?
No, I don't take that anymore because I have a, fairly, I'm eating too much really, which is why I have to adjust. So I think it's only for people maybe in the first year when they can only take in a little food. They have to supplement.
You're not eating any multivitamins.
No.
Although we recommend our patients to take 1 tablet of multivitamin, but practically this is what we see. They don't eat it because once everything is settled, everything is normal. But still, you need a good diet. Yeah, healthy diet, more of protein. You're taking chicken or fish?
Yes, all protein.
So how frequently you take fish or chicken?
Well, every day really. In the West, you eat a high protein diet naturally.
So that is the reason why all your reports are good, because you are eating good. That's what we need to convey to our patients. If you want to get bariatric surgery done, it is very safe, very good, but it can give you some nutritional deficiencies.
Which is why you always have to get yourself, and that's why I come back every year for a checkup. Although it's not strictly necessary now, because it's been 6 years.
You don't have to worry about it, but your diet should be good, high, rich in protein. Thank you very much.
Okay.